A title appears, Mental Health Provider Module. Lesson 1, The Role of Culture and Diversity in Working with Families. Colorful dots float around the screen as text scrolls past.
In this lesson, we'll present aspects of culture and diversity that mental health providers should consider when working with families. We'll also share helpful strategies you can use in the field.
An animated boy appears with a light bulb for a brain. He turns to face us with a smile and tilts his head.
As you've learned, children's perceptions of ACEs and their ability to cope with them are influenced by a combination of factors across the social ecology. These factors include children's unique life experiences, relationships, and environments, as well as structural circumstances and other economic and social conditions that influence the health of individuals, families, and communities.
An animated therapist appears, holding a file under one arm.
As a mental health provider, it's likely that you work with children from diverse racial, ethnic, religious, and socioeconomic backgrounds who are influenced by a range of cultural differences. They may come from two-parent homes, single-parent homes, foster homes, and other living situations with friends and relatives.
Animations depicting the different types of families flash by. The animated boy appears again, and two moms holding hands appear beside him.
The children you work with and their parents and caregivers may have varying sexual orientations and gender identities. Parents and caregivers will also have varying approaches to parenting based on their own definitions of household and family roles. Their views on discipline, their expectations and experiences, and their cultures, values, and beliefs will further influence their parenting styles. Other aspects of culture and diversity you may encounter include differences in country of origin, language abilities, citizenship status, and cognitive and physical abilities.
Beverly Fortson, PhD, CDC behavioral scientist and licensed clinical psychologist.
When children and families present to a mental health professional, they're typically bringing with them the culture and diversity of their families, of their environment. So it really is important for mental health professionals to think about that in whatever treatment they're providing and whatever assessments they're providing so that they can provide services that are appropriate for the culture, the diversity of the family.
Nikia Scott, PhD, licensed clinical psychologist, Georgia State University.
It's important for mental health providers to think about the context of culture and diversity when working with children and families, primarily because of respect to start. Building rapport, especially when talking about adverse childhood experiences or instances of abuse. Respect is the most basic level with which you can join with the family. I think it's important for mental health care providers to be willing to be the student as well as the teacher. And for many minority families, this is an important part of building safety, trust, and the ability to open up about experiences that they may not be willing to with a traditional, physician office setting. Being willing to just learn from the person in front of you and think about the inherent sensitivities that exist in what you're asking them to disclose or discuss.
An animated girl in a blue coat appears and tilts her head. More text flashes by.
Every child and every family is unique, and sometimes those differences can put children at risk for ACEs or create challenges for youth who've experienced ACEs. These challenges relate to discrimination, unequal access to resources and services, and limitations imposed by existing laws, policies, and social norms. These factors can affect a child or a family's understanding, perceptions, and experiences of adversity. They can also affect a child or family's ability to prevent or respond to ACEs, their help-seeking behaviors, and the effectiveness of different approaches to prevention and intervention services.
Beverly Fortson, PhD.
Culture and diversity relate to adverse childhood experiences and prevention in the fact that different cultural groups are sometimes exposed to events, life circumstances that make them more or less likely to experience adverse childhood experiences. An individual's racial ethnic identity, for example, may make them more likely to experience certain events or activities in their life that make them more susceptible to adverse childhood experiences or the outcomes associated with that.
Nikia Scott, PhD.
When I think about how culture and diversity impacts help-seeking behaviors, I think about families that are under-resourced, particularly families that have limited access to transportation and funds with which to get to services. I also think about the stigma that exists within particular cultures. For example, African American populations are often taught that if there's something happening within the home, it should stay within the home. And that perhaps the primary form of intervention or coping should be faith-based. And so trying to reach populations that are coming to the table with an idea that they should not be speaking to you about the things that happen in their home makes it much more difficult to engage and retain those families. So it's important in those instances to honor the place from which they come and to reinforce the fact that the services that you're providing are not meant to combat or to compete with the other positive coping strategies that they employ.
The animation of the therapist reappears, smiling as she holds her file.
As a mental health provider, it's important to be keenly aware of the possibility that the children and families you work with may be affected by these and other challenges and disparities. Services that appropriately reflect and respond to culture and diversity can result in better engagement, healthier client relationships, and improved outcomes. Take some time now to further explore aspects of culture and diversity and strategies you can use when working with children and families.